Are you a person who is curious, process-oriented, accurate, self-sufficient, and fascinated by science? Do you have keen observational skills, good color perception, and manual dexterity? Are you able to work under pressure, work alone and with a team, and are accountable and responsible? Then you might just be one of the many who is qualified for a lab life. Enroll in BS Medical Laboratory Science Technology or BS in Medical Technology at Jose Maria College. There is a vast landscape of opportunities waiting in the field of medical laboratory science work. You can choose where you want to spend your lab life with. Medical technology professionals are mostly sought after in hospitals, private laboratories, university research labs, public health facilities, biotechnology companies, specialty labs, scientific equipment sales. In Jose Maria College, we have highly trained professionals and high-tech facilities to help prepare your future lab life. Enroll in Jose Maria College and flex on the new normal in education with our flexible learning modality for an assured, consistent, and quality education. For more information, visit our website at www.jmc.edu.ph or our Facebook page at facebook.com/Jose Maria College. You can also email admissions@jmc.edu.ph for admission requirements for the BS in Medical Laboratory Science Technology.
As the coronavirus killed
The number
more
of
than
people who've
200,000
contracted the
I can't say it
coronavirus
enough.
continues to grow.
Enough
More
people
than
have died.
1,600
We don't need
Americans
research
infected.
like crazy.
The virus has come not from China.
Fighting the coronavirus is
Spent weeks minimizing what is clearly a very serious problem. No doubt these people have good intentions.
I think the pandemic has reminded us how we do not have enough doctors in the right specialties and in the right places. Since the beginning of the pandemic, if you would try to remember, doctors have been working round the clock in order to save the lives of people. And in the process also of doing this one, many dedicated doctors succumbed to the deadly virus. And we know all that one in many news that we have seen. We also see hospitals overflowing with patients, understaffed, but then the battle continues. This in itself is a manifestation that the growing need for doctors in every corners of the world remain to become a reality and at the same time a problem. The path to a significant curricular reform is a difficult thing because of a variety of factors, to include the challenge of physical distancing, since we all know practice-based learning is the backbone of education, especially among doctors. We need to see patients. We need to harness our skills, knowledge, and attitude by looking at patients, okay, so that this would be able to enhance or forge our professional identity and develop an orientation to a patient-focused based care that would shape the practice of future medical doctors. We wanted to produce doctors with a heart. And our goal is also to define a unique characteristic that will be anchored to the local needs and national health needs of the people of Mindanao. I believe looking at the vision mission of the college and influenced by the universal healthcare law, I think we seek to envision and integrate a comprehensive approach that will be cost-effective, promotive, and preventive, as well as curative, palliative, and rehabilitative, one that would encompass the entire domain of the individuals and the population, particularly here in Mindanao. or we are trying to be committed in producing medical doctors imbued with a heart to serve and is willing to contribute for nation building in our country. And I think this is always a possible. This is always our strategic plan to set apart GMC as a college of medicine. We wanted to create doctors with a heart. We are very lucky. We have our own LMS, the Learning Management System, powered by Huawei. This is the first in the Philippines. Everything is there in terms of lectures, in terms of resources for learning. And I think our new generation could adapt of it because these are the computer-based population. The COVID-19 has resulted in schools shut down all across the world, and education has changed with a distinctive rise in the new method of learning. And I think adaptability and ingenuity were the two core values that we have learned from this experience. Dream big. They have to dream big. Dare to dream. As long as you have the dedication, you have the passion of becoming good doctors in the future, we welcome you to the College of JMC, especially in the Department of Medicine.
Good day, fellow J Marians. Check your ticking clock. It's 7 minutes past 6 in the evening. Welcome to your Wednesday habit. This is MedTech Hour, a show where we delve into technologies that diagnose, treat, and improve a person's health and well-being. Now, the current surge of COVID-19 pandemic continues to threaten our society. Let us learn more about the current situation, the importance of vaccination, and the sudden surge and the Omicron variant in our discussion for this afternoon. This is very timely and so relevant. And on that note, we have with us to be our reactor today. Would you please help me welcome? Joining me this afternoon in the show, we have Sir Francis Cedillo. Sir, good afternoon and welcome to the show.
Hello, good afternoon, everyone who are watching with us this evening or this afternoon, wherever you are right now. And thank you so much, College of Medical Technology, for inviting me as the co-host for this MedTech Hour. Thank you, Sir Vincent.
All right. Sir, I think it would also be good if we do a quick shout out sa ating fellow MedTech Hour family joining us this afternoon. I think we have some so far. Batiin lang natin. I think we have one. We have one joiner ito. We have Tyrone Jackson, available data on Moderna COVID-19 vaccine administered to pregnant women are insufficient to inform vaccine-associated risk in pregnancy. Oh, maybe know where is Sir sino ulit yun? Jackson. Baka from abroad ito, sir, ha? I told you. We have friends from
Yes, sir.
overseas.
Parang abroad ata. Yung si Sir Tyrone Jackson ba yun? Kinote
Yes,
niya
kasi
from
napaka-English
Moderna.
niya.
Di ko lang maano
I
yung
see.
verbatim talaga. Pero oo.
Alright.
Oo.
Okay, sir, ano ba yung pag-uusapan natin for this special episode? I think the title is, can we share that? It's Breakthrough Cases. Understanding COVID-19, vaccination surges, and Omicron variant. All right, sir, you ready? We're now going to welcome to the show our speaker for this MedTech Hour episode, the Dean of the Medical Technology Department. We have with us Ma'am Maria Bea Eslao. Good afternoon, Ma'am Bea.
Good
Welcome to the
Good
show.
afternoon.
afternoon. Good afternoon, Sir Vince and Sir Francis. And good afternoon to all our viewers. I think we have this certain level of pressure if we really have international audience. Therefore, we have to be we have to be careful, and we have to, of course, talk in English, straight English. Okay, but it's kind of timely, no, the post of Mr. Tyron Jackson, because indeed we do really have limited data as of now in terms of course, referring to COVID. Okay, so I am so happy in behalf of the College of Allied Health Science Education. We are so happy that we have this MedTech Hour, because this really becomes an avenue so that we can share information so that people will know more. Diba? Because ignorance is not an excuse, really. So it's good that we have this show, we have this segment, then we can share information about, in this case, in our episode for tonight, we will be talking about breakthrough infections, breakthrough cases, of course, related to COVID-19, the vaccination, the surge, and the Omicron variant.
All right. So just a quick overview, Ma'am Bea. We're gonna be talking about three things. That's again the one that you just mentioned. We have updates in COVID-19 today, as in today, and surges and breakthrough cases, and the Omicron variant. All right. Would you please show to us just a quick run through the updates of the COVID-19 cases this day as of today?
I think this is as of January 26, no, 2 o'clock in the morning. The total cases here in the Philippines is this is 3 million already. Actually, this going to 3.5 million, and we have 53,598 deaths. It's good news that we have almost 3.1, no, million recovered, but sad to say, we still have active cases right now. And this is our number of active cases. Okay, so we have 280,813. And I think this is a rough estimate, no, because I'm pretty sure there are some um, who are not really recorded. I think that's one of the things that I will give emphasis later on, especially in helping the government really have a good data. Now, out of these cases, 8,000, almost 9,000 are asymptomatic. When we say asymptomatic, there are no symptoms. Parang usual lang. Okay, it's just the usual. They look healthy, but they are actually having an active case of the COVID-19 infection. There are 267,000 that had have these mild symptoms, and almost, no, 1,500 have severe. Ito yung severe, these are actually monitored, no, from time to time, hospitalized, and of course, given with extra care. And we have 303 cases of critical cases, meaning these are the ones who are in ICU units. Okay, so this is actually a quick update in the Philippines. Now, would you like to know kung ano ba yung daily cases, no? Kasi last year, towards the end of the year of 2021, we have a fairly good number. No, we still have active cases, pero the trend is going down. Okay. Now, let me show you the latest data that we have for the past, this is past 6 days. Okay, so we will start from 20 up to yesterday. Now, as you can see, the trend is actually almost going up. We actually had peak, no, January 23 with January 22, 21, 31,000 cases every day. Okay, so this is on a daily basis. Now, tignan natin yung graph, Sir Vince and Sir Franz. There is a huge difference. Um, yung nandito sa left side, okay, the January 4, we have 29,862 active cases. Okay, so this is actually a good number compared to the previous months. Um, it means the number we're actually going down. But if we will try to compare here, January 21, no, the active cases on this day was 291,635 active cases. So if you will take a look at it, that's 10 times increase of the number in a span of less than, this is around 15 16 days only. Okay, so ganun biglang tumaas, ganun na biglang nag-surge ang cases for COVID-19.
I
So
see that was in the entire Philippines.
yeah,
What
yeah,
about
this is the
locally
entire
in
Philippines.
Davao? Okay, in Davao region alone.
Okay, this is actually something that we should know because we are residing here in Davao City. No, we belong to Davao region. Now, in Davao region, um, we have new cases. No, this is as of yesterday, January 25. The new cases was 780. So this is a 51% positivity rate because the number of tests were 1,509, meaning there were 1,509 individuals who were tested, and out of that 1,509, 780 were actually positive. Okay, but the total active case that we have is 12,101. Okay, so that's actually quite a big number of active cases. No? Um, Sadly, we also have this deaths. No, yung mga bagong namatay yesterday, there were 11, and out of this active cases, 99.6% are actually manifesting the mild, moderate, and asymptomatic case, meaning they just look like a simple flu, and that's 99.6%, which is something good. In if we will try to analyze it, it's actually something good because the 99.6% that are currently active cases of COVID does not really need hospitalization. Okay, which is something good uh, as part of being infected. However, of course, the difficulty of still having a high cases, active cases, meaning we still have high chances of transmitting the infection to another person. So this 99.6%, they have this mild, moderate, asymptomatic case. If they will not quarantine themselves, then they can transmit it to others. They can still transmit it to others. So this is quite the tricky part in controlling the COVID-19. Now, I would like to give emphasis because we have here a breakdown, no, of the data. In Davao City, the number of new cases yesterday was 520. So if you take a look, no, out of within the Davao region, Davao City has the highest number of new cases. Okay, and then I would like to emphasize on this one, no, because this is something that we should actually be informed. No, I hope those who are viewing right now, you will see the reality that we are experiencing. This will show you the capacity of the city, no, of the region in terms of catering COVID patients. No, meaning this will include the hospital, this will include the isolation facilities. So here in Davao City, um, siguro I will give emphasis on SPMC. Now here in our SPMC, the Southern Philippines Medical Center, they have a total of 370 ward beds, but the 370 is actually occupied, used. Out of 87 ICU beds, 72 are actually used. And for the isolation beds, out of 73, 64 are actually used. Now, what's the implication of this, Sir Vince and Sir Francis? If ever the number will continue to rise and there is a need for hospitalization, we will actually experience difficulty in admission of patients. Okay? Because all the beds are already used, no, it's occupied. And the difficulty that we will encounter, of course, if the number will still continue to rise, it's possible that there will be number of patients, number of our fellow citizens here in Davao City will not be able to, they will not be catered anymore because they will not be catered not because they don't want to cater it, but because there are no available beds, there are no available facilities. The same with the ventilators, no, mechanical ventilators. Though we still have really a good number, no, 55, only 25 are used. However, even if you have the ventilators, but if you don't have beds where the patient can stay, then it will be difficult. Okay, it will be difficult. So I think the two medical centers that we have here in the region, SPMC and DRMC, the ICU beds, no, they are quite loaded already. No, Sir Vince, ito yung reality na meron tayo ngayon. Okay?
All right, Ma'am Bea, given that picture or that figure, what are our siguro alternatives?
Well, the actually the city already projected, no, that there will be a possible surge. In fact, this is written by the city government, no. Davao City braces for COVID-19 surge. They already projected as early as beginning of the year that we will actually encounter surge of the COVID-19 virus. So as of today, this is actually a very recent headline that we have. Uh, we can actually have the home isolation. When we say home isolation, if you are categorized under the mild and asymptomatic case, then you can be just quarantined at your home. No, though it's actually quite challenging because it means that you must not also expose yourself to any of the family members or anybody that kasama mo sa bahay. Okay, you are living with at home or in your respective boarding houses or your apartments. So this is actually one way of helping the mitigation. Of course, we cannot force the government to really supply us with isolation facilities because even last year we already have that difficulty. So right now with the surge that we have, um, home quarantine or home isolation is actually suggested already. Okay, so in fact today, no, in this is a published 822 houses are on lockdown. And this is only in Davao City. So ganun kadami, Sir Vince and Sir Franz, ganun kadami ang cases, active cases natin ngayon. And most of them are actually asymptomatic. I think isa sa mga ano tawag yan, it's good that there is asymptomatic because majority, I don't know if really we are on the majority part already of the population that are vaccinated, pero the vaccine is actually a big help, no, that even if you are infected, at least you are sure you have that chances, low risk of developing into a severe case of severe infection of COVID-19.
Mm. By the way, Ma'am Bea, before we continue, since you have mentioned earlier about those the common cases right now are those who have mild symptoms. What are those mild symptoms, by the way, categorically, so that
Well,
everyone will know?
we know for a fact that COVID is flu. It's actually a flu. It's a flu disease. It's a flu infection. Therefore, the
Yes.
symptoms is just similar to a flu. When you say
Mm-hmm.
flu, cough and colds, no, slight fever,
Mm-hmm.
usually runny nose, headache, body fatigue. That's the usual symptoms when we experience flu. It's as simple as that, right? But in COVID case, we actually have add-on, and sometimes for mild cases, they experience this one: loss of sense of smell and the loss of sense of taste. No, walang panlasa tsaka walang pangamoy. Kaso lang, 'di ba? Even the walang panlasa and walang pangamoy is also common in cases of flu. Na kasi pag hindi masyadong maganda yung sinisipon tayo, chances are hindi rin maganda yung panlasa natin. Okay, so this is actually the tricky part right now. Kasi if you have noticed, early January, malamig ang panahon. 'Di ba? The
That's true.
weather was actually too good na medyo malamig. Hindi medyo malamig talaga, no? Early in the morning and late in the afternoon, malamig. There were actually cases na hindi mo na alam. Ako, honestly, it's quite difficult for me to know physically kung yung kasama ko ba dito sa bahay is just experiencing the usual flu, or is it already a COVID-19 infection? Because the symptoms is basically almost the same.
Mm-hmm.
That's actually the challenging part. That's actually the challenging part in our for our government, for our DOH and the city health, no? Because some I actually know some either kapitbahay namin or talagang relative ko na hindi sila nagpapatest because they are too afraid, even though the symptoms will somehow suggest that it's COVID-19.
Ma'am Bea, if you may have known, ano ba yung reason nila? Bakit sila natatakot?
Oo nga.
Well,
Yun yung
um siguro for this is something legit, no, for those who are working on a daily wage. Kasi if they will be confirmed positive, therefore they will be forced to be isolated. And sadly, some, I think, some or most of our especially the populations in our community, they don't have really this emergency fund. And it's actually one of the reason why they are too hesitant to be tested, because they don't want to be quarantined for 10 to 14 days, because it means they don't have any pay for that time frame. Another
Yep.
is
And
yeah, that's actually a common, a common
yep.
problem, especially
Now,
for those yung daily wage nga na no work no pay, mga ganun.
mm Kasi
yep.
may
Okay,
pamilya
another
na.
And Ma'am Bea,
is
and it also implies, di ba, that they have to be spending for those days. So, wala nang kita, then they have to
yes,
spend pa.
yes,
Diba? So,
yes.
double the pain.
Yeah, which is really quite difficult, especially for those na wala talagang savings. Okay, another another reason, especially I'm sorry for this term, especially for those close-minded na medyo senior ang age, no, which is fairly common in our community. They are too afraid because they don't want to be labeled as someone who had already this infection, because whether we admit it or not, there is actually a certain stigma. There is a stigma na once they know that you have this infection, um I don't know if it's I don't know if it's discrimination, but there is certain stigma.
Ano ba yun? Sorry, excuse me. Ano yun,
Ayan
gina-cast
na.
out tayo, ganun ba yun?
Oh, I think for some, no, especially for those really living in areas where the population is not educated or not really familiar with the current the need of that certain family. Merong mga ganun.
Maybe na the word ma'am is kanang they are not well informed no?
Yes, yes, I
Regard,
think so. Because honestly, there are really some na no offense with their opinion, but there are really some that what they are saying is far from scientific findings. No, yung mga in short, ito yung mga false news, mga fake news na kung ano-anong mga sinasabi nila. And sadly, with the social media that we have, marami pa rin ang naniniwala. 'Di ba? That's actually a sad reality. Buti na lang talaga meron tayong MedTech Hour kasi this is one way of sharing the scientific evidences that we have. At
mm.
least no mabawasan yung mga fake news.
Ma'am Bea, just to interrupt you in a short while, given that reasons, no, na they're considering their livelihood, the fear of having this stigma of as a tag to be COVID-19 positive. So, what can you advise to our viewers if you have someone or friends maybe or even relatives if they have this fear to be tested.
Number one, of course, as much as possible, it is better for us to know if we are infected or not. Because aside from we will be able to monitor ourselves or our relatives, at least if we will isolate ourselves, we will not be able to transmit to the infection to other people, to other person, to other individuals. I think that's basically one. It's part of our actually I am challenging everyone to be socially responsible because uh with this no uh yung pag-deny mo na hindi siya COVID-19, you are not actually helping the community, you are actually contributing to make it worse because if ever you are COVID-19 positive and you refuse to isolate yourself, then you are actually continuing the transmission from yourself to other individuals. Okay, so lahat ng pwede mong makasalamuha in that day, possible ma-infect. Okay, now for those members of the community who are adding burden for those family na infected, please help them in any way that you can. COVID-19 infection is just the same as flu. No, of course, the worst case scenario, no, for severe cases when it will be a full-blown pneumonia, nagkakaroon ng problema talaga doon sa patient. However, it's just a simple flu, just like any flu, it's also easily transmissible. Okay, just so happen right now our ano tawag yan, our health sector is not really prepared in terms of handling severe cases of COVID. So, in any help that you can, though personal experience no nung because I actually experienced to be quarantined also. It's actually feeling good for us na there are a lot of friends and family members who continuously provide us with food, no, may mga food, fruits, even vitamins, and a simple prayer will actually help. Okay, a simple prayer will actually help.
Mambaya,
Thanks.
just to I'd like to
See, sir.
share with you some of the sentiments or some of the shares by our viewers. I think we have gone too far, Mambaya. Umabot tayo ng Japan. Eh. We have viewers from Japan.
That's
Yejin
good to know,
Salvatore,
sir.
hello watching from Japan. Hajimemashite, Yejin, ayun. Um, meron ding dito na sinabi niya, ito yung experience niya. Sabi niya, hindi pala yun, iba pala. No konbanwa o Tsukoshi Hitobito. We have one from Caris Cruz. Sabi niya, true mom. She agreed with what you said earlier, Mambea. Me and my baby have been admitted po. We had to wait 3 days sa pedia for us to be admitted. Punong-puno po ang sikip na po ng emergency room and admission. So, ganun yung scenario. This was 8 days ago po. No beds na po talaga. Folding beds na lang po talaga na nagkadikit-dikit.
This
Kaya
is, Sir Vince, this is actually the reality that we have. No, because of emergent cases, of course, they have to be admitted. When you say emergent cases, those patients that needs to be monitored. Uh, Kaya nga, if just if I may just share, hospitals right now, they already it's no longer a first come first serve basis, but it's more on categorizing the more emergent case. The more emergent case will be prioritized. The less emergent, pwedeng mamaya. It's not that they are discriminating, but they are trying to save life. Therefore, yung mas emergent, mas um, in short, no, yung mga, kumbaga, kung sa Bisaya pa, kamatyo nun, yun yung inuuna talaga. Regardless kung last pumasok, pero very emergent yung kanyang case, then it will be prioritized. So it's actually a sad reality. Um, Not that our city government or not that our government is not capable of this, no, in terms sa ating hospitals, pero 'di ba, which country do you think was really ever prepared for this pandemic? No, worldwide, we were actually in shock. And this is the problem that we have. This is the reality that we have right now. That if the number of cases will continue to rise, and if there will be increasing cases of the severe cases of COVID-19, then we will really have problem in terms of accommodating these patients in our hospitals.
I see. I think the Mambea, they have color coding or
Yeah,
whatsoever.
yeah.
Ano ba yung concept niyan sa medicine? Um I don't know. I am even perplexed as to how severe is. Kasi I have observed, no, kasi noon siguro I would describe myself siguro nung una na OA ako na. I had sa tenga ko, Mabe, yung masakit sa tenga. Then alam mo yung feeling na in-interview ka pa ng nurse in a scale of 1 to 10, gaano daw kasakit? Sabi ko 11, bakit ba tinatanong pa ako? And so, and then there are other na the feeling ko or that they appear to me as though parang mamamatay na sila. But, doctors are so relaxed and I was like, okay, I think this is just normal for them. So, ganun siguro talaga yun. They know exactly who to prioritize. Siguro alam na nila yung mga ganun. Kasi
They
anyway, nakakahinga pa naman ako. Tenga lang naman yun. So, yeah, I was
they
just
actually
OA.
have a they actually have a logarithm actually for that, no. Meron silang parang guidelines talaga na sinusunod.
I see, ganun pala yun. Alright,
Mm.
yeah, ito Mabi, in Japan, still, restaurants and bars close early as a move to arrest the surge. But life goes on as usual. Ano ba yung Mabi, may ano ba, may time limit ba yung ano? May timeline ba yung ano, ng virus?
Um Actually, if we can control the movement, no, if we can control the transmission, therefore eventually mawala yan siya. No, if we will be able to stop the transmission from one person to the other, eventually mawawala yan siya. Kaya nga one of the initial action of the government was no movement. Remember the first few months of pandemic that we are really on ECQ, no, that's really no one is allowed to leave their houses unless it's for basic necessities. That's actually one way. Kaya nga if we will look at the data, um, we have surge, and then they will have this control of movement. Eventually the number of cases will decrease. Okay, why do we have a surge right now? I think it's as simple as because there were a lot of movements during December of 2021.
Mhm.
'Di ba? I mean, the malls were packed.
Yep.
Um, Even the jeep, no, it's already full packed as well. It's as if it's
Mm.
the usual life that we have, except that we wear mask. Okay, so it's probably one, though it's actually in public health that's actually quite connected. No, there is there is a relationship between the movement of the people and the rise of cases. So isa yun. Now, in terms of ilang days no within your system, kung ilang araw ba na mabubuhay yung virus in your body, actually it will always depend on your immune system. Because if your immune system is good, then your body will be able to fight it off.
Mm-hmm. And to
Okay?
learn more, they may check our previous episode on that note.
Yes, yes,
Right? You
actually that's
yes,
yes.
immune system down. But anyway,
So
you mentioned surge. What causes COVID-19 surge, by the way?
okay, now we mentioned surge. No, when you say surge, this is the sudden increase to an unusually high level. So this was our data. This is from February 15, 2020 up to this is January 26, I think, okay? So this, as you can see, no visual representation lang. We will actually see that our cases right now, January 2022 cases is higher than the last year. Okay? We had the surge last year. Ito yung from March, April, May, June. Okay? And then we have a second increase around August, September. No, but this level is not as high as we have right now. Okay? Yung ito yung peak na makikita natin. This is what we can uh, describe as the surge. So, what causes COVID-19 surge? Basically, we have to check the vaccination status. Okay. So later, I will give emphasis on approximately how many percent of the population no, are already vaccinated. Second, strict compliance of the safety protocol. Simple wearing of mask. Um, Buti nga nawala yung ano na yung face shield because yung may face shield meron bang mandatory wearing of face shield. We are wearing it pero we are not wearing it correctly, so it's actually useless. But mask alone is good protection. Okay, mask alone is a good protection. So simple, correct wearing of mask is very important. That includes social distancing. That also includes hygiene practices, because as long as you make sure that you constantly wash hands or use hand sanitizers, kasi isa sa common reason why we can acquire is because of the surfaces or the people that we are touching. Okay, so 'di ba, our hands can, when you wipe your face, for example, then it's possible that the virus is already in your hand. So hygiene is very important. Next is the gatherings. No, itong socialization, indoor and outdoor dining. Now, one of the things that we can actually, again, going back, no, probably contributing to the increase of numbers that we have right now is because of the gatherings, the socialization, the indoor and outdoor dining that we had during December. Okay, so medyo maluwag talaga tayo nung December. Sadly, it's I myself, when I go to the mall, I fear for the children that I see. No, kasi yun nga no, parang as I describe it, nakawala sa hawla. Madaming nakalabas. Okay, madaming namasyal, madami ang nag-shopping, okay? But sad to say, because of those socialization, because of those hindi na controlled yung movements, probably this contributed to the surge. Okay. Now, I will go directly no to the vaccination status. This is actually a data that I was able to see on the net. No, Philippines has already administered 123 million doses of COVID, but this is per dose, so not per person. Now, if we will take a look into the consideration that Philippines has 111, it's almost 112 million population. And in this population, the priority for the vaccination are the health workers, the frontliners, the senior citizen, the high risk population, meaning those with comorbidities, and then the general citizens that are 18 and above. And recently, we already have the 12 to 17 years old. If we will try to compute for that, that's roughly around 50 million of the population are vaccinated. Bakit 50 million? 123, we divide it into two doses per person. And then we have to consider that health workers and frontliners and even the seniors already have their boosters. Therefore, hindi talaga siya automatically divided into two. Okay, so roughly around 50 million of the population are vaccinated. Therefore, we still have around 60 plus million of the population that are unvaccinated. So that's more than half, no, of people na unvax. So this might still contribute to the surge because kahit na ikaw vaccinated ka, you are not sure if the people around you are unvaccinated. Now, the problem that we might encounter is for those unvaccinated individuals, these are the people who are at higher risk of developing COVID-19 into a severe cases. Okay,
Ma'am
so
Mm.
Bea, with that note, talking about the vaccination status, I have seen here from Cassie Lorenzo. She said that some do not want to get vaccinated for personal reasons. Is there something that people should be afraid of in vaccine? So, what can you advise to those people, ma'am, na they are still not going to be vaccinated because they have this kind of apprehension na still if you will be vaccinated pareho naman din magkaka-COVID pa rin.
um eto kasi I would like to respect no for whatever reasons that they have that they don't want to be vaccinated because that's their judgment. However, on my tayo kasi na nasa healthcare, okay, we also have to consider the health of the general public. Okay, the moment that one will not actually any percentage in our population that refuse to get vaccinated, then the risk of having COVID-19 with severe cases is still there. I would like to make an emphasis there is equal risk no na magka-COVID pa rin whether you are vaccinated or unvaccinated, meaning kahit vaccinated ka, you will still be infected of COVID-19 if you are exposed. No, hindi naman sinabi 'di ba ng mga vaccine provider na hindi ka na magkaka-COVID if
That's correct.
vaccinated ka.
Mm-mm.
Yes. Ang sinabi nila is, if you are vaccinated, then you are reducing the risk of developing COVID-19 infection into a severe case. So, it means you will still be infected, but you will just have these mild symptoms where you will eventually recover. Whereas if you are unvaccinated and you acquire the COVID-19 infection, you will have the risk of developing into a severe case. No, yung pneumonia, God forbid, you will be hospitalized doon sa ICU where you have to have equipment so that you will be able to breathe. So, the purpose of vaccine is not really to yung hindi ka na ma-infect, no, for you not to infect, but to lessen the severe cases of COVID. And on earlier variants of the SARS-CoV, actually, for those vaccinated, there were cases that if you are vaccinated and you are infected, you will not be able to transmit it. Okay. However, the case is different in terms of Delta and the Omicron variant.
All right, Mabe, how do they differ? Is this the reason why we have booster shots? Is it because of the evolving variant of the virus?
Well, the booster is actually let me just give this example. For example, the flu vaccine, the flu shots that we get annually. Diba? It's actually an annual. Ideally, if you want to have the flu shots, the flu vaccine, it should be on a yearly basis, right? Therefore, it's somewhat the same in terms of COVID-19 vaccines. No, um, the protection, your protection in COVID-19 is not long lasting. There are also different kinds of vaccines kasi. No, I think this is a good topic for separate medtech hour. But there are different types of vaccine. There are vaccines that you only need one shot and you will be protected for life, and there are vaccines that you have to constantly have it, just like the flu vaccine. So I think that's the reason why there is a booster, so that especially the frontliners, especially those who are already vaccinated, they will continue to have the protection.
Okay. Ma'am, in addition to your discussion, I have seen here from Cassie Lorenzo again. She mentioned earlier that almost every day now has flu. And is it already Omicron? Omicron na ba daw ang variant? So, what are we going to know pala kapag symptoms of COVID na siya, or Omicron variant na ba ito, or simply just flu?
Okay. Um Basically, if we will just look at the signs and symptoms, it will all just look like flu. No, because if signs and symptoms lang ang basehan, there is no way for us to know that it's COVID infection. Okay, therefore, in order for you to know that it's COVID infection, then it's either the antigen test or the RT-PCR. That's really the diagnostic test. Now, in terms of identifying if it's a Delta variant or an Omicron variant, then it has to undergo genome sequencing. Okay, medyo may genetics na part. So, in RT-PCR, we will not be able to see the variant. Okay, so there should be a genome sequencing, which um, most medical centers are actually doing it so that they will be able to identify what variant, DOH specifically as well, kailangan nilang i-identify yan so that yung response natin, no, the response of our city health, of the Department of Health, of our local communities will be against the specific variant. So again, I will clarify, if we will just look at the flu, you will not be able to see if it's COVID already or if it's a certain variant of COVID. Okay, it has to undergo testing. And then for the detection of the variant, it has to undergo genome sequencing para ma-identify. But basically, the symptom is the same, no? Whether it's an Omicron or a Delta variant. Actually, I have here a comparison, if I may proceed.
Sige,
No,
ma'am.
the
Yes, ma'am. Yes, ma'am.
comparison, no comparison of we the CDC call this, the CDC and the WHO call this as the variant of concern, because right now, last year the variant of concern was the Delta variant, and right now late 2021, no, medyo umaangat itong si Omicron variant. Now let us try to compare. The Delta variant is more contagious compared to the previous variant. Yung mga early onset ng COVID during early pandemic, no, ibang variant 'yon. Si Delta is already more contagious. When you say more contagious, I don't know if it's clear. Let me zoom this one. Yan. The original COVID-19 strain, no, for every time na meron kang exposure, more likely dalawa lang ang ma-infect mo. But in Delta variant, it can be as high as 5. Okay, so that's one way na more contagious siya. And the Delta variant might actually cause more severe illness than the previous variants in unvaccinated people. Then, since we already have this vaccinated population, um, breakthrough infection is still possible. When you say breakthrough infection, this is actually when you are already vaccinated but still you were infected of COVID-19. Okay. Now, this is something that we should consider, always consider. Vaccinated population may still spread the virus to others, but they are of shorter time compared to the unvaccinated individuals. Now, let us try to compare doon sa Omicron. Omicron is also more contagious than the previous variant, and this includes Delta variant. So mas mabilis yung kanyang transmission. Generally, Omicron is less severe compared to Delta. In most cases, si Omicron parang mas usual flu lang siya. Okay? Pero still limited kasi yung data natin, no, but still we have cases of Omicron na variant na COVID-19 infection that are hospitalized, especially for those unvaccinated individuals. So still it's possible that for those unvaccinated individual who will be infected with the Omicron variant, they will still ano tawag niyan, have a severe case of COVID. So, hindi masyado malayo yung difference nila. Except that, mas mabilis ang transmission ng Omicron variant. Kaya nga kung mapapansin ninyo, dati, the surge will rise in a span of weeks. No, weeks yung pagdadaanan before siya aakyat yung cases. But right now, especially itong pagpasok ng January, we are just counting days and then almost 20-30% increase on daily cases. So it's possible, based on my professional opinion, it's possible that the predominant case that we have is Omicron because the Department of Health already confirmed that we have local transmission of the Omicron variant.
Ma'am Bea, ano ba yung dinadescribe nila or what do they ano ba yung can you tell us more about what they quote unquote call stealth Omicron virus? Bakit stealth?
I'm not really sure no kung bakit siya stealth, pero I think it's because this is limited pa yung data natin eh in terms of kasi 'di ba the rise of the Omicron variant started I think around November, no, going December in other countries. I'm not really sure why they described it as stealth. Maybe I also need to know more about that.
Sige po sa next discussion natin, why not? Let us have yung tinatawag na stealth Omicron. I don't know if it's just the same with Omicron or I think iba rin yung stealth Omicron at saka Omicron. Let's clarify on our next discussion. But now let us try to wrap up perhaps with our frequently asked questions because I believe our viewers also share the same questions na dito na nilagay natin or the ones that we prepared. All right, can
Okay.
we go through those frequently asked questions? Go
First,
ahead po, Ma'am Bea.
actually no, medyo na ano na siya, nasagot na siya. Are the symptoms different from other COVID-19 variants? Actually, the symptoms are similar. Cough, fever, fatigue, loss of sense of taste, and the loss of sense of smell. And in severe cases, they will experience pneumonia, the difficulty of breathing. So
Mhm.
basically, pare-pareho lang talaga ang symptom niya. So there is no really a specific way based on signs and symptoms that you will be able to know if ano tawag niyan, anong variant siya. Okay? Okay, another. Actually, this is a fact check, no? Vaccinated and unvaccinated population have equal risk of acquiring COVID-19 infection.
Mhm.
However, unvaccinated population are at higher risk of developing severe cases than the vaccinated population. Now, isingit ko lang ha, I think nakalimutan kong banggitin ito. Right now, the most at risk, no, in our population are the unvaccinated population. So
Mhm.
whether it be senior na unvaccinated or yung 18 to 60 na unvaccinated and definitely yung pediatrics, no, yung mga younger population. Now, here is the challenge that we have. For example, here in our home, dalawa ang working, okay? So Good for me that I work from home, so andito lang ako with the kids. But my husband is working on site, therefore he is going outside and he is exposed in the environment outside. For me and my husband, it's okay because we are vaccinated. But the moment that my husband enters our house, no, enters our home, he will be exposing himself to my children that are not yet vaccinated. Therefore, you as a vaccinated individual, you should also be responsible of your actions wherever you are, because you don't know if the people that you are encountering every day are vaccinated or unvaccinated. Kaya nga, if this is ano ha, I don't know if we have actual record, pero most of the cases that we are probably ano yan, rising at right now is the case of dun sa mga pediatric cases na na-infect ng COVID-19. Kasi nga, unvaccinated pa sila. So, they still have this risk of developing into a severe case. Actually, medyo challenging talaga siya. It's also challenging for parents like me to make sure na dito sa aming bahay, um, the house will always be clean and free from infection, free from the COVID-19 infection. Kasi nga ito, vaccinated people can still transmit the infection. That's the challenge. No, vaccinated people can still transmit the infection. Okay? So let me proceed. Yan. Can the Omicron variant be able to spread more easily than other COVID-19 strains? It is believed, no, based on early studies, that Omicron are more likely to easily spread than the original COVID-19. So it appears to be more contagious compared to the Delta variant. So this is reference is the CDC. So mas mabilis yung kanyang transmission. Kaya medyo challenge, no? For sure masakit na rin ng mga ulo nung nasa DOH, nasa IATF, para even our LGUs, no, trying to work on kung ano ba ang dapat gawin. Now, another question, no, what is a breakthrough infection? I think naririnig na natin to last year pa lang, yung breakthrough infection. When we say COVID breakthrough infection, these are cases of COVID-19 infection in vaccinated population. Okay?
I
So,
see.
ito yung tanong, is it usual to have breakthrough infection? Yes. It might actually be common kasi nga we are still on the pandemic. However, if you are considered doon sa breakthrough infection, this doesn't mean that vaccines are ineffective, because again, vaccines did not promise a 100% efficacy, but yung protection natin is yun nga, not to develop into a severe case. So, ito yung mga common na tanong, di ba? Are vaccines effective against variants of COVID-19? Now, for early variants of COVID-19 and the Delta variants, vaccines are known to be effective. Sa ngayon, we have very limited data to tell us kung effective ba yung vaccine doon sa Omicron variant. So it's actually an added challenge, no? But merong initial findings that there may be small reduction in the effectiveness of the vaccine towards the Omicron. But for the early variants of COVID-19 and the Delta variant, it is effective. Kaya nga kung titignan natin, yung sinasabi nila na hindi nila ako magpag-vaccine kasi 'di ba, it reduces the effectiveness. No, that's a very wrong mindset. Kasi nga kahit na rising yung cases ng Omicron ngayon, it doesn't mean that we no longer have the Delta variant. And remember, Delta variant is a more severe case compared to Omicron. No, Omicron is less severe. Okay, so we still need to be vaccinated. Okay, we still need to be vaccinated. Yan, this is another question. Nagkaroon na ako ng COVID-19. Do I need to be vaccinated? Okay? Yes. You may have developed some natural immunity because you already have the infection before, but there are no data available that will tell us that immunity is long lasting. Okay, so in terms of long lasting, no vaccines offer a more reliable protection. Okay, so right now, who are at risk of acquiring COVID-19? Actually, everyone. No, everyone is at risk. However, higher risks are assumed for those unvaccinated population, the senior citizen, pediatric population, and especially individuals with comorbidity, especially yung mga diabetic tsaka high blood. Okay? So what do I need to do to protect myself and my family? Wear mask. Okay? And wear it properly. Hindi yung nakababa or expose yung ilong. No, you have to wear it properly. You have to protect your nose and your mouth. Okay? Then social distancing. We still have to continue social distancing. Your area should have a good ventilation. If ever you need to go outside, no, yung mga pupuntahan natin, then ventilation should, dapat maganda yung ventilation. Okay, and of course, proper hygiene practices. So, if I am experiencing the symptom but not sure if it's COVID-19, what do I need to do? Simple. Have yourself tested, and while waiting for the result, isolate yourself so that you will not transmit it to others. Okay? I am vaccinated and I am not exposed nor experiencing any symptom. Boost your immune system, follow safety protocol, and be mindful of your actions and routines. Sometimes maganda pa rin na alam mo no kung saan ka nang galing kahapon so that easy ang tracing. Now, what if I am unvaccinated? I am not exposed nor experiencing any symptom. What precautions should I do? Still, you have to boost your immune system, follow safety protocol, be mindful of your actions and routines, and please be vaccinated. Okay? By being vaccinated, you are not just helping yourself, but you are also helping the general public. Okay? So, baka may mga tanong pa, Sir Vince. No? Baka may mga tanong pa na kaya
Sige
pa
po, Ma'am
nating
Bea.
sagutin.
While Sige po. While waiting, we have some experiences here. One from Justin Joy Berte. Sabi niya, my COVID experience nung first dose pa lang ako and hindi ako nakapag-swab if positive ako or not kasi always ako nag-chill right after 3 days. Right after 3 days, nawala na ako ng panlasa and pang-amoy. Nung nag-second dose na ako, sinabi ko po yun sa doktor and he said if nag-take ako ng test, is nag-positive ako. But now, na nag-positive ulit ako kasi nagpa-antigen na po ako. Halos walang effect na sa akin ang virus kasi naka-take na rin ako ng booster shot. Hashtag share ko lang. Okay. So, isa lang masasabi ko na, Bea, wag matakot magpatusok, magpabakuna, di ba?
Yes, magpabakuna. Okay? Pero
Added
sir,
protection pala talaga.
yung cases na gano'n na after vaccination, parang may symptoms ka na nafe-feel na it's COVID na symptoms yung feeling. It's actually possible.
Mhm.
Kasi nga 'di ba, in our vaccine, they are actually introducing a certain protein no nung doon sa COVID-19 sa ating system. So initially, part of our body to react no talagang meron yung mga reaction na magkaka-fever ka, magkaka-chills, okay? But I did hear cases na after booster and after second doses, parang mga 3 days, 4 days after nag-positive sila sa COVID. There are many explanations to that. It can be that even before sila nagpa-shot, exposed na sila, hindi lang nila alam. So that can be. Okay?
I see, yun pala yun. Sir Francis, meron tayong dito before we end, meron tayong isang medyo nakakatawa na na share. Pakibasa po.
Oo. Sabi daw ni ni Reza.
Reza Jane.
Oo. Jean F. Maninga. Sabi niya, some people don't want to be vaccinated with COVID-19 vaccines because they're afraid of turning into a zombie, which is ridiculous. What a myth. Kadalasan man talaga, 'di ba? This is their ano to? Assumption or their mindset na 1 to 2 years would last and you will be zombie. But that is just fake news or myth, 'di ba, sa mga tao. So, it's better to be informed or well informed on the benefits that we can get from vaccines um, rather than accepting that information in which it would not help you yourself and even your family members also, 'di ba?
True. Pero
Mm.
alam mo, sir, yung yan kasi, again, I don't want to, I respect no their opinions pagdating doon sa yung personal opinion nila about the vaccine. Kaso lang,
Mm.
what I don't like is they will encourage others not to be vaccinated. Kung parang naghahanap pa
Totoo.
sila ng kasama na, oh, wag na tayo magpa-vaccine kasi yan nga, and then
Oo.
marami na silang reason.
Oo.
Hopefully, gamitin natin ulit ang MedTech Hour soon, no? Na know more about the vaccine. Kasi nga, baka totoo yun na maraming hindi nakakaalam yung tungkol sa vaccine and how vaccine can actually help us. And this is not only referring to COVID, ha, vaccine as a whole, 'di ba? Marami naman tayong mga infections and diseases na pwedeng maiwasan basta vaccinated lang tayo.
Alright. And I think it would be exciting if makapresent na tayo ng studies and researches, Mabea, na
Yes! Oo.
siguro I think we have studies siguro. Ipakita natin yung study nung bakit ayaw nilang magpabakuna. Or
That's
do they
actually ano,
believe na
sir.
magiging zombie yung
Ano yan, vaccination resiliency. That's actually, may mga available na ano yan, questionnaires about that. So, malay natin, di ba? That's a project that JMCFI can do. And it will help the city health.
Sige,
Actually, this
sige. I think
is
that's
what Sir Vince and Mambea, this is what I'm actually planning to do, di ba, Mambea? I told you to that in College of Allied Health Sciences, together with the faculty members, we will be conducting research on COVID-19 vaccine hesitancy. But
Mhm.
I believe the participants that I have mentioned it to you would be the parents because right now we are starting uh inoculate the vaccine to the students, right? Those who are
Mm-mm.
I think from 12 to 17 ba yun or 18 na mga students. So they need to have waiver man din from parents. So some parents, di
Yes.
ba, ang parents man din ang nag-decide. So some parents have this hesitancy. So it's good to know what are those reasons as to why hindi nila ipavaccine din yung anak nila. Kasi we are in the process of having limited face-to-face in the near future. I'm not just sure as to when, but I am sure that it would happen, di ba, ma'am? Sir.
Yep, I totally agree. Yeah, that and more exciting points. Perhaps we can have that on our next episode, Mambia and Sir Francis. No? So exciting, especially yung stealth Omicron. Hindi pa kasi malinaw yun sa akin
Sige, I will
na
give that to
concept.
myself as my assignment.
Sige po, Ma'am.
Yes.
Yep. Kasi as much as we want, we are almost how do I say it? We are almost running out of time. I believe so. But don't you worry kasi we will put that on hold. Yun ang mga part or yun ang mga questions because we will have a separate discussion for those um questions or queries. All right. And yeah, before siguro we we bid goodbye, Ma'am Bea, really thank you so much for joining us this afternoon sa ating MedTech Hour. We might have a write up out of this live stream because
Yes.
it's also good that this will be made available through writing. This will be put into writing so that we can also share to non-viewers but our readers. Okay. Ayan. So, and of course, thank you so much din po to Sir Francis for joining us this afternoon, ang acting co-host, and to all of our MedTech Hour friends from all the way from Japan. We have one from Japan, and of course from Davao City rin. And I think it's good that we read this one before we bid goodbye, Mambea. Basahin lang natin from Caris Cruz, the public should be aware of contact tracing. The public should be aware na merong free RT-PCR provided by the government after nila matawagan ang contact tracer and mas-schedule sila for the swabbing. Para ma-isolate sila agad, mas ma-restrict yung nilang actions and may record agad ang case nila. Yup, totoo yun.
Yes. Sir, ano ko na lang din, shout out ito
Yes,
sa
ma'am.
mga students no ng BSMT ng JMCFI. They are
Okay.
watching and thank you for ano. Actually, may mga assignment ito sila kaya they are
Yup.
watching.
Prepare for a quiz, for a surprise. Okay, anyway, that has been another fruitful discussion, a 1 hour discussion with our show. This is a show about the diagnosis, the treatment, and improvement of anyone's health and well being. We'd like to see you in our next episode. This is once again MedTech Hour. God bless everybody. Stay safe and goodbye. Bye bye. Thank you, Mom Bea, Sir
Thank you,
Francis.
Sir Vince. Thank you, Ma'am Bea.